I want to welcome everyone back for the next panel, and I will hand it over to Carl Warden to introduce the next panelist. Carl.
So you want me to be unmuted to say stuff, do you? All right, then. Good morning, I'm Carl Warden, and thank you for coming to the annual convention of the Conservatorship Association of Tennessee. We have a distinguished panel who will be talking about issues this morning. There's August Geter, who is the mental health director for Shelby County Jails and Juvenile Detention Services in Memphis, Tennessee. There's Michelle Reed, who began her career with the Kansas Department of Corrections in 1999 and became the director of WellPath in 2011 and has a degree in clinical psychology from Pittsburgh State University. Sarah Vardell. Dr. Vardell is with the Mental Health Cooperative. She's the director of Criminal Justice Services, providing, oh my God, very important services. He's a licensed clinical psychologist. Dr. David Imhoff, who is an inspector with the Metro Police Department and someone with whom I have dealt on a number of occasions very happily. And he is very concerned about the intersection of conservatorships and law enforcement in the state of Tennessee. And I want to welcome all of you and thank you very much for participating in this panel discussion about mental health and justice system, as well as the pilot WellPath program that has been started by the Metropolitan Nashville Police Department. So panelists, thank you very much. And whoever would like to talk first, please feel free to go ahead.
There we go.
I'm happy to start if you need me to. I'll just tell you a little bit about what we're doing over here at the police department. Back in last year, Chief Drake, who was the chief of police here in Metro Nashville, he was named interim chief back last August of 2020, and then that interim title came off in December. And then after that, he put together, when he became the full chief, he approached me. I had been the commander of the East Precinct for nearly 10 years, and he asked me if I would start the Office of Alternative Policing Strategy, which comprised of 3 basic programs, one of which was juvenile diversion, one was a group violence intervention program, and one that we're here to talk about today, I guess, to a certain extent, is our co-response program, our Partners in Care program, dealing with mental health calls for service. So we worked for a very long time with several community partners, including Mental Health Co-op, who's our prime partner, ourselves, the Mayor's Office, Department of Emergency Communications, Department of Health, Hub Nashville, and Fire and EMS. And we had working groups for several months putting together this program. And what the program is having a clinician, a master's level clinician riding in a police car, a marked car with a uniformed officer. The officers are all volunteers in this program, and they've attended 40 hours of crisis intervention training, and they respond to mental health calls for service. That started on June 28th in a pilot program in 2 precincts, our North Precinct and our Hermitage Precinct, during Monday through Friday during our first 2 shifts. So from 6:30 in the morning to 11 o'clock at night, we've had those programs running now for a while. The pilot is 1 year, and after 1 year, we hope to expand that, which means we're going to need funding to help Mental Health Co-op expand their services on this. And we want to train all of our officers in crisis intervention training to better deal with these types of calls for services. There was a lot of debate at the beginning of this involving whether we should go with a CAHOOTS program or a co-response. And we found out through our pilot, we decided to go with the co-response based on the fact that it deals more with people suffering from severe acuity and higher levels of psychosis than what the CAHOOTS model is kind of built for. And our early numbers show that that really bore out. We've been dealing with a lot. The volume has been a lot greater than we anticipated, and we can talk about the numbers a little bit later. That just gives you kind of an overview of what we're doing over here. And I appreciate y'all inviting me. Thank you very much.
Thank you. Ms. Reed?
Yeah, I'll go next. First, I'd like to apologize for not dressing as fancy as you are, Carl.
I have court later today because otherwise it might be a t-shirt or something.
Okay, now I feel better about myself. So as you mentioned, my name is Michelle Reed. I'm the Regional Director of Mental Health for WellPath. WellPath is a company that provides medical and mental health and dental services to jails and prisons around the country. And in the state of Tennessee, we provide services in Shelby County, which is Memphis. And August Jeter was planning on being here, but she had an emergency at the facility this morning. So she unfortunately will not join us, but Dr. Sarah Vardell is here. And our other site in Tennessee is Davidson County. Now, with the Davidson County mental health, the mental health is done by the co-op. And Sarah, if I'm stealing your thunder, please let me know. By the mental health co-op, which WellPath then subcontracts with. So we're still very involved and in contact on a regular basis. So with the two facilities in Tennessee, they're run basically the same from mental health. And I think what we want to do next, Sarah, is have you kind of discuss what goes on at Davidson County, if you don't mind.
Don't mind at all. And
Great.
I did want to say, with the co-responder program, it's been amazing, especially with just wanted to comment, amazing, especially with the mental health cooperative staff, writing with the officers, because we are getting amazing information on the front end before inmates even are brought in to book. And we're able to be very well prepared for them when they get here and to know what's going on and have that information. Y'all are doing an amazing job. So I wanted to throw that out there. I do have a PowerPoint, and I'm not sure if that's something that Amy puts up or if I need to try to share it. And
You should be able to share your screen. I think I've enabled that.
there it is. Can you all see that?
Yes.
I'll actually make it be it'll let me, there we go. Before I start, it's a pleasure to be here. Thank you all so much for having me. I do want to say the lights in my office go off spontaneously. They are motion activated, so unless I am moving around, they tend to go off. So if it goes dark and you see me look like I'm doing the wave at the Titans game or doing some weird interpretive dance, I'm really just trying to get the lights to come back on. So I'm not sure how to, there we go. So as Michelle was saying, WellPath, formerly known as Correct Care Solutions or CCS, they've been contracting to provide the healthcare services at DCSO since 2005. And the Mental Health Cooperative has subcontracted the mental health services part and work as actually incredibly well as a partner with WellPath here, providing the mental health services. It has worked extremely well for us. Just a little information about our team here at DCSO. The sheriff, if you all are not aware, is very proactive for mental health issues. So he has provided us with a very strong staff. I'm the team director. I have 13 licensed master's level mental health clinicians working in the 4 facilities, 24/7. We have full-time staff and booking. So there's always a mental health person in booking to immediately address any acute issues that walk in through the door. We have a full-time psychiatrist, 2 full-time psychiatric nurse practitioners, and a full-time psych RN on our team. Whoops. As far as the services that are available, again, we are able to provide mental health assessments during the booking process, which often helps us, I guess, funnel folks to the appropriate services, get them on a list to be seen by a psychiatric provider if necessary. place them in housing that is appropriate for them if they're presenting with symptomology that would lead us to believe they wouldn't be safe in general population. We also do comprehensive assessments post-booking. We get calls from family members, we get calls from attorneys, we get calls from the staff here if they have concerns about folks, if they're not caught during the initial part during booking. And inmates can also place their own sick calls if necessary. And we see those individuals very quickly. And we have our psychiatric evaluations as indicated by our advanced practice nurse, psychiatric nurse practitioner or psychiatrist. And we do psychiatric evaluations and initiation of medication, and then they receive routine follow-ups after being started on those medications. We also provide crisis intervention. We do have crises that occur in the facility. We also are able to provide evaluations if need be for involuntary commitment. A majority of my staff are trained to do those evaluations and to submit that paperwork for hospitalization. And we provide regular rounds in our special needs and segregation units as well. It's so hard to tell that an audience if people have questions, but
Sarah, can I throw some things in there real quick?
sure.
So just to give everyone an idea what it looks like when someone is arrested, they are brought to the jail, booked into the jail, and that includes an officer will ask some questions to that individual. Do you have any major medical issues? Do you have any mental health issues? That's just kind of a quick, do we need to respond right now? Does the nurse need to come out to the car? Does mental health need to come out to the car, the police car, for any sort of serious issues? And if the answers to those are no, there's nothing imminent happening, they're brought into the facility and then they will see a nurse. And that happens in both Shelby County and Davidson County. They see a nurse who asks a variety of questions, including mental health questions. And from that, they are referred to mental health, who we have in booking at both facilities as well, 24/7, like Sarah mentioned. And so when they say yes to mental health questions, meaning, do you have a history of mental health issues? Have you taken medications in the past? Are you taking medications now? To other questions, like, is this your first time in jail? Do you have a guardian? Those sort of questions also get referrals to mental health. And so then we see those people and determine really what needs to happen with them next. Do we need to get some collaborative information? Do they need to see the psychiatrist? Kind of on and on. There's a litany of things that we can determine need to happen. And with that too, that's not just all that happens, as Dr. Vardell mentioned, throughout the whole entire incarceration, we're actively involved with a lot of the people that are in jail.
Thank you, Michelle. That was informative. I appreciate you walking through that. When you work someplace long enough, you assume that other people know what happens, and I appreciate you
Right.
jumping in.
Agreed. Agreed.
And when you talked about, we follow a lot of the folks, just as an idea, over time, our average daily population, the big blue lines, has gone down, some in part due to COVID, some in part due to the jail, the old jail downtown being torn down, the new jail being built, having to move inmates around to, be able to house them effectively and safely. But what we've noticed is when we talk about a SPMI or individuals that are diagnosed with a serious and persistent mental illness, that's the yellow line here. And you can see, despite the fact that the number of inmates we have in the jail are decreasing or have decreasing. They're starting to come back up a little. The number of those with a serious and persistent mental illness are continuing to increase. The slight drop in here is due to when we moved the female inmates over to the old CoreCivic or just CoreCivic. As women tend to access mental health services more than men do. And statistically, just research shows that the number of women in jails and prisons tends to be statistically higher, but that accounts for the drop in the numbers when the women moved out. But as we can see, clearly the number of those with a serious mental illness in the jails is continuing to increase. So we have approximately 1,600 or a little bit over that inmates in the jail right now. We're running at about 28% of those with a serious mental illness. And this is some of the data across the board through the years. As you can tell from 2006, the team had about 7,700 referrals. By the more recent years, which of course I can't see because my screen has pictures on it. As you can see, last year, even with COVID, we had over 22,000 mental health referrals for services.
And these numbers aren't exclusive. I mean, these numbers are exclusive to Davidson County, but we see the same trends all across the country, unfortunately.
So these were actually the number of contacts. So that's the number of actual face-to-face visits we had with inmates. This is how many referrals we got. And those are specific referrals. Sometimes it's that we're just on a unit and somebody says, hey, can you talk to this guy really quick? Last year, our SPMI population ran about 22%. And as I said, this year with the women coming back into the under the services of DCSO, we're up about 28%. This little screen again. There we go.
Do you think that the increase in the percentage of population and the increase in population is due exclusively to a rise in mental illness, or is it due to better diagnosis and identification of people who have those issues?
You know, it's probably a combination of both, and add in there just honestly a lack of available inpatient bed space to really adequately deal with those that we send to the hospital. We have some really acutely ill folks here, and typically the stays at the psych hospital, which is only MTMHI, it's the only place we can send somebody for services, tends to be relatively short because the demand on those beds is really high. I do think we're doing a better job at catching people on the front end now that we have folks in intake and in booking, catching people very quickly, because often those with misdemeanor cases would come in and before they could even be seen, they would get released or bond out. So we are catching a number of those. And I do think just the mental health population in general does seem to be growing. We do seem to, and especially through the co-op, do seem to see a lot of individuals who either have very limited or no insurance. Those that are homeless are difficult to reach. And a lot of times those folks, if they can't get there for medications, they do tend to relapse. I would add in as well, there does seem to be a pretty steep increase in substance abuse, specifically with opiates, and we're seeing an increase in the use of meth here specifically. And I think that is impacting it. Research shows that about 75% of those with a serious mental illness also have a substance use disorder, which really can complicate the person's success once released, and their, I guess, their ability to get follow-up services and to stay sober. So, Michelle, would you have anything to add to that?
No, you took the words right out of my mouth.
Oh, okay, there you go. Did want to talk to y'all for a second about the Behavioral Care Center that we're very proud of here. Again, one of Sheriff Hall's initiatives, really fought hard to get this. Of course, it opened right during the middle of COVID, which posed a lot of complications, but the Behavioral Care Center is supposed to be a true diversion program. It did open in October of last year. They've had, well, at least through the mid-September, they've had a total of 266 admissions. Of the total, 56 have been rearrested since being discharged. However, a lot of these folks are the ones that we were seeing in a revolving door, continually getting out, getting rearrested, getting out, getting rearrested. The fact that only 56 have been rearrested is pretty phenomenal. And again, it's designed to divert those individuals with mental illnesses and or substance abuse issues who were charged with misdemeanor offenses. What we've kind of found is it's been rolling along. Some felony cases are now being accepted at BCC following a pretty strict review process. And someone from the district attorney's office, someone from the public defender's office review those cases that come in pretty much every day to see who's maybe appropriate. And the goal is to, as quickly as we can, divert them from booking into treatment over there. They have to be willing and stable enough to participate. They have to agree to the services. And if they complete the treatment over there, charges may be dismissed. But they're able to provide detox services. They're able to hook them up through discharge planning. They get into therapy immediately. They start treatment planning and discharge planning immediately, making referrals to substance abuse programs, making sure that they're embedded in outpatient care, that they're helped with housing issues, to help if possible, getting insurance turned back on if it's been turned off, and to try to help them with whatever those pitfalls are that contribute to falling right back into reoffending, to see if we can't get some of that taken care of before they're released again to the street, and maybe fill in those gaps that again contribute to rearrest. Individuals generally can stay from 10 to 30 days. The program has 60 beds, 30 for females and 30 for males. So they've really done some amazing work so far and are continuing to try to look at things differently and to see who best they can help along the way. Because it really is the revolving door that Sheriff Hall was most concerned about, and just the rearrest rate with those who we know well, and who would be appropriate for a program like this.
Some great things about this program is the revolving door, like Dr. Vardell mentioned. People are in jail a short period of time. Sometimes we have very limited contact with them because they bond out or they're there for a misdemeanor. So they're not there long at all. And so in that time, we can't provide them the services that they need. And going to the behavioral care center, they're really getting much more intensive treatment, which helps them succeed on the outside. And having those charges being dismissed is so important, because it's hard to get out of the system, unfortunately, once you get in it. When you continue to become rearrested, when you're mentally ill and you're picked up on just very minor charges, there's not a chance for people to get stable that way either. And so with the BCC, 56, that number may seem high to people, but that is a win for us for sure.
Absolutely. And as Michelle said, just to sort of continue on one of her thoughts, is mental health medications take a minute. It's not like an aspirin where you take one and you get well. And it gives often that 10 to 30 days gives people time to actually get on those medications, get the meds in their system, begin to think more clearly, have more hope about the future, and then become really invested in making some positive change. So it's pretty awesome. And again, kudos to Sheriff Hall for really pushing for it and seeing it as such a positive initiative.
Yeah, and that's a great point on the medication too.
The staffing over there is Lacey Monday is the program manager. And again, she's the one who meets with the district attorney's office and the public defender's office weekday mornings to review cases that may be appropriate. Private attorneys too can get with Lacey and say that they're interested in maybe their clients coming in, at which case then the district attorney's office works with the private attorney as well. And all parties have to agree that the person is appropriate for treatment. Again, they have to be stable enough and willing to participate in the program. She also has 2 master's level mental health counselors who provide individual and group therapy services, 2 bachelor's level resident counselors, a bachelor's level discharge planner. We have a psychiatric nurse there 3 days a week and a psychiatrist there a day a week. And WellPath does provide the medical services for BCC as well. We also, through the co-op, have criminal justice liaison services. It's a state-funded grant position for one master's level clinician. It began in 2001, and they provide assessment, linkage to services for inmates who are eligible for release. They can go in and do discharge planning. They work closely with mental health court, and they also provide extensive training and community outreach to criminal justice personnel on identifying signs and symptoms of mental illness and community resources. I know they're also involved in working some with the sheriff's office doing training, as well as the Nashville Police Department. DCSO does offer some programs. Unfortunately, again, COVID did kind of quash some of these for a bit, just due to risk, but they do have the New Avenues and Healing Journey, which are both intensive outpatient programs. They have SAVE program, the Batters Intervention Program. They provide reentry services through SOAR and Men of Valor. The Second Chances program, High Set. I know they were doing testing recently for folks to get their GED. And they have culinary and barbershop services. There are just a number of programs that DCSO provides that are really important and beneficial to the folks here. I hope I'm not taking too long. I did want to talk about some of the myths regarding mental health services in jail. It is a myth that there are extensive wait times to see a mental health for a mental health referral to be seen. Again, inmates are offered mental health assessment during booking, and routine referrals to mental health are seen within 48 hours, generally within 24. So they're seen very quickly, much more quickly than if I was to ask for to see a provider on the outside, that's for sure.
Agreed. Sarah, we had a question that came through on the chat.
Oh, sure.
About the BCC. Are meds healthcare provided after the stay at BCC, and what agency follows up with the care?
Generally, there are discharge medications that are provided. I believe it's 15 days worth of meds. And there isn't a particular provider. It's not like we funnel them straight to the co-op. It depends more on their needs and their preferences and their insurance. If they have insurance, generally their options are broader, but that's part of the discharge planning, that they do hook them up with whatever agency. It could be Centerstone, it could be, if they're not Davidson County folks, it could be wherever it is they work or live, and they do make that part of discharge planning if medication is needed to make sure that they are hooked up with those services. Were there any other questions? I hope I answered that, but.